The future of medicine depends on great physician leaders, and we are moving towards value based care from fee for service. We have a physician who's written a chapter in this guidebook that we've been following, and we're interviewing physicians. The CMO essential guidebook that Mark Olsnick put together through AAPL, and you can order it. We'll talk about that at the end. But she wrote this chapter called "Population Health and Value-Based Healthcare." And if you don't need a master's to understand what she's saying. She lays it out in a way that you can understand. She has graphs, visuals. It's an excellent chapter. So pick up this book. We're talking to today Catherine Mindy Chua, and we call her Mindy, and she is a chief medical officer of Davis Health System in West Virginia, and has had a number of different roles, and also has been certified not only in family medicine but in functional and integrative medicine. And she told me, I'm not really somebody who thought I'd get into politics. I just wanted to do my job. But now that I've learned more, and she's a lifelong learner, and now just finished a master's in population health, she's telling me she is really involved in the community in West Virginia. So it's very admirable. So let's bring her on here. Mindy, thank you so much for being here. Appreciate it.
Hi, thank you for the introduction.
Yeah. So tell us a little bit about, I know we got in this topic. Why did you choose to write this chapter on population health and value-based care? Why this one?
I've been very involved with the population health department in our facility. Actually, I was on the ground floor when we started it. Prevention is the most important thing that we can do in medicine right now.
Okay.
And as I started to learn more about population health, I realized how important it is that physicians really understand the difference between fee-for-service and value-based medicine, and that physicians get actively involved in driving that change.
Okay, great. So again, she wrote this chapter, Population Health and Value-Based Healthcare. Why is it that the future of medicine depends on great physician leader? And I just want to say really quickly that you brought up two really great points before we go into why physicians there's a dichotomy, you said, between value-based care and fee-for-service. Tell us a little bit about, for those people who out there might not know the difference and what that is and why we're moving towards it. Tell us a little bit about this dichotomy.
So in our current fee system that most of us are under. Now, there are some regions of the United States that have moved towards value-based, but for most of us, we get paid per encounter, per visit. And in a way, it's actually, we're getting incentivized for doing bad care, because if I don't treat you well in the beginning and I bring you back multiple times, then I'm getting paid for every time I bring you back in. Every time you hit the ER, every time you get an inpatient admission, I'm getting paid for that. And so we're, the system was built around that kind of a model where you're actually not getting incentivized for taking good care of patients. And I think that ideally we want to be, as hospital systems, we want to be that place where you go only if you're very sick.
Yep.
I think that as hospitals, we need to be stepping outside of taking care of sick people and actually helping our communities to take care of wellness.
Right.
So that dichotomy, it's a lot of the population health journals and things, they have this cartoon of a doctor standing with one foot on a dock and one foot in a boat. And that's kind of where we're at. We want to do better. We want to model quality care, but on the other hand, we're still getting paid fee for service. So we have to still generate those encounters. And it's a little difficult, I think, to make that financial case for that change.
Yep, very good point. Yeah, and you brought up the hospital partnership with public health services in the community is so key. And it's not sustainable, the system that we have fee for service, and the government is running out of money. So how do we get people healthier? And in your chapter, you wrote, how do you get people healthier? And then the patients are happier, the physicians are happy because now they're going to have more time to spend with patients and do the things that we want to do. And then the hospitals and the organizations are happier because now they're going to have shared savings. And so everyone kind of wins.
Right.
Yes.
And I think that that's why we need physicians in leadership, because as physicians, we got into this for a certain reason. Most of us got into this because we want to improve the lives of our patients.
Yes.
So we have a different approach and a different motivation than somebody who, say, is coming from a business background. So my motivation to do better isn't because necessarily I want to make the bottom line better. It's because I want to make my community more healthy. And as a physician leader, you learn about the finances, and we understand the bottom line is important. You can't operate without it. Population health tends to have a longer term return on investment, and that's difficult to get people to really kind of embrace it, because you can't really say, well, you're going to make X amount of dollars by doing this. So you have to sort of build a case for population health around those things, like you mentioned, shared savings. We can improve our bottom line if we can make shared savings. And so then you need those physicians at the table saying, okay, well, let's change our contracts. Let's start making these value-based contracts so that we can get those shared savings. And then you build volume. You can build volume with your ancillaries. You're ordering all the mammograms and the colonoscopies and things like that. Right. So you're going to build volume that way. And then you're also going to build volume just by becoming that part of your community that people look to lead the change in healthcare. You're right. Trying, they're going to see that you're actually doing something to improve the health of the community, and you'll get volume that way.
Absolutely. And you also mentioned a third thing. So physicians understand long-term care, you said, and physicians are motivated to improve healthcare. So why not help them be co-leaders in this healthcare organization, not just administrators and finance people, but physicians also are looked upon for answers by the community.
Mm-hmm. Can you talk about that? Mm-hmm. Exactly. And that's, not all physicians know how to lead it, but we're put in positions from the time that we start medical school where we are looked to for answers.
Yes.
So, I think that it's important to train physician leaders, because I don't think inherently people just know how to lead. But when you come with that kind of motivation, you come with that kind of community respect, and then you add that leadership piece in, I think that it makes for an excellent sort of leadership model. And they talk a lot about a dyad model, and I think that that's fantastic, because you have your physician leader who understands the clinical piece and understands that long-term care piece, and then you have your more business leader who can help to navigate some of the pitfalls of that dichotomy between the two.
Right. I think more and more physicians are catching on, and healthcare organizations about value-based care and a fee-for-service. You did mention a great example, and that's ChenMed is doing this.
Mm-hmm. Yeah, I see that you did. You spoke with ChenMed or the CEO of ChenMed in the past, and yeah, I mean they are held up as the number one, I think, example of how you can make this work. And in their model, they have exactly what we talked about. The physicians are happier, the patients are well cared for. And so their admission rates are lower, their ED visits are lower, and they have better quality of life. And I think that as physicians, that's what we need to be pushing for.
Yep. And in your chapter, you did speak about offering wellness as a part of the model of care, and very strict standards of care, evidence-based medicine, instead of people doing all different kinds of things based on what they remember or what's worked for them. And that would help make sure that we're doing the right kind of things for the patients.
Right. And that's another way that you can make this model successful, is because, the studies show that over 50% of the cost in healthcare is waste. So if you can eliminate waste, you can eliminate cost, and therefore you have more resources to do the things that you need to do to make your community well.
Right. Awesome. This is so great. And so this should incentivize all stakeholders within healthcare as we move towards value-based care. It seems so challenging, and ChenMed's been able to do it, and should be a great model for us to follow. So thank you so much for this quick interview, Catherine. Mindy, I appreciate it. How can people reach out to you if they want to ask you any additional questions?
Feel free to email me. My email address is chuac@davishealthsystem.org. I'm pretty good about getting back with emails, so feel free to reach out at any point.
Great. Thank you so much. Join us at leadphysician.org if you're a physician looking for leadership training, and reach out for a quick call. Also, if you have a podcast that you want to talk about on physician leadership and how that affects healthcare, please reach out to me at info@drlcco.com. Any last words for us, Mindy, as we close? I'm going to keep calling you Catherine.
That's okay. I think that you had mentioned about the political thing, and I think that that's just become so important that it's not only us here at the front line that need to be changing things. I think that there has to be some policy changes at a more national level if we're going to be able to make these contracts work. So that's where, when I never thought I would be political, now I'm going to the American Hospital Association regional policy board meetings. And, if we're really truly wanting to make this change, we need to be the ones participating in those sessions.
Right. We want to pass down generation to generation from our kids to their grandkids a better healthcare system for everyone, instead of being the lowest of the OECD countries, and have a better cost of care. Thank you so much for being on here. Until next time, thank you, everybody.